This is Coach Tess, and today we are going to be focusing on the urinary system and the male reproductive system. So today might be a little bit longer than usual. But guess what? We're still going to have fun and we're still going to learn a lot of things, a lot of keywords for the CPC board exam. So let us jump right in. All right, make sure you have your notepad or so you can make notes. You can also use the AAPC study guide, to go through some of these terms, and this will help you. Whatever materials we use is AAPC certification board exam level, so you're just learning a lot of things that you might not learn when you do other things, or you see in other books you don't know what they are or what might be expected on the exam. So let us make it happen right away. All right. So it's going to be, this exercise is going to be both urinary and male systems mixed up together. So don't think I'm jumping all over the place, okay? So we are going to just go in alphabetical order like we've been doing in other chapters. Remember to subscribe because we drop videos daily in this series, okay? So leave a comment, ask a question, okay? All right, let's go. So ablation. Ablation is the removal and destruction of body part or tissue or its function. So a lot of the times you see this in scopes like endoscopy, the EGD, which is the esophageal gastroduodenoscopy. You might see it in all different scopes in the digestive area, but then you'll see it here in the urinary area as well, where you have the cystoscopy. Very weird looking terms, but it is just how you basically make out some of those terms, understand them, which is once you understand your anatomical side. So ablation, when they're doing scopes, most times this is what happens, okay? Allograft, remember when we were in musculoskeletal or musculoskeletal, or you might musculoskeletal, you might see in musculoskeletal where you see allograft, a graph of from an individual. Let me see right here, allograft. Graph from one individual to another are the same. Anastomosis, that's another one I forgot to put a green beside. Right here. So we've seen anastomosis several times. So we've seen anastomosis in cardiovascular, we see anastomosis in digestive. Now you see the same anastomosis in the urinary and male section. So what they do is, in urinary, the urethra is a long tube from the kidney to the urinary bladder, okay? And sometimes they might have to shorten it and maybe stitch it back together. So that's the anastomosis. That's just one procedure. It can be several, but that's how it works, okay? And now let's move on to aspiration. So with the term right here, the term aspiration, there is a difference. So you need to, when you're reading, pay attention to what is an injection versus an aspiration. So pay attention to those two terms, okay? So the injection is they're putting liquid in or fluid in, and the aspiration is pulling fluid out. So pay attention to that one, All right, let's move on. There's a lot of terms, but some of them I'm just focusing on just some. Okay, autograph. You notice up here we have allograft, and down here we have Allograph, and now we have autograph. So now there are two words that look very similar. So you have allograph up here and you have autograph down here. So be careful of when you're reading these things. You notice that they're very similar. So the suffix is the same, graph, but up here it says allograph, and down here it says autograph. I can't go through some of the definitions, all of them, but I'll just go through some of them. But these are some of the words that you'll see in some of these scenario questions on the test. But what the role of these videos are to help you to identify and to decipher which one is needed in that test, so you can select that answer and to be accurate. Okay, so that is the most important thing. All right, let's go down here. I'm pulling my book close up. Brachytherapy. You're gonna see brachytherapy also in medicine. I think it's medicine. You're going to see that again. Calculus, carcinoma is too. Malignancy. So sometimes you might not see the word cancer, but you might see the word carcinoma, or you might see malignancy. Okay? All right. Now, look at this one. It says chronic interstitial cystitis. It's pretty much is an inflamed lesion of the bladder wall, right? So sometimes you have to know also the difference between acute and chronic, right? So pay attention to that. Circumcise. Now, circumcise is also a procedure. So let me highlight this green right here. Right, circumcision it's pretty much takes place primarily in babies. So the age is very important. So when you look into the male section, circumcision, it has like a one tiny parenthetical notes with modifier 50 and all that type of stuff. 51, sorry. Pay attention to that parenthetical notes in circumcision in male. All right, so I'm giving you some guideline stuff, and we're going to go through guidelines as well, and we're going to be highlighting our book. That's another series coming up, and we're going to go through some of those things as well. All right, cryotherapy. We've seen cryotherapy in integumentary. With an intense cold of ablation of treatment. In integumentary, we see cryotherapy of a lesion when we're doing destruction. So see, now we're still using that name, but that word, but then you'll realize that it might be in one section, but then it comes over in another section. So you need to know when it is being used and what body part they are working on, okay? What the doctor is working on, all right? So pay attention to that as well. All right, let me turn the page. So the reason for me doing videos like this is just how you study. And, instead of just going through a PowerPoint, we want to go through just like our students study, and we're going to do it the same way. Okay, so we have a lot of greens on this page. All right, so let's look close up, because that's how we study, right? All right, so you have cystostomy, formation of an opening through an abdominal wall. So ostomy is a surgical opening, right, into the bladder. So cysto is bladder, so you need to know your anatomical name. So it's the surgical opening, right, of the bladder. So you read it backwards. Ostomy. Look down below. You have an incision. So there's one. All right, so look at this. So you have the ostomy right here, and you have the otomy right here. See it? So now it's the same body part they're doing, but it's two different things, right? Two different things. All right, look at debridement. We seen debridement in integumentary. Now the debridement is back again, removal of dead or contaminated tissue. Debridement, okay. Dilation. You're going to see dilation again. It's a term that is used in a lot of sections, so you'll see it again. Dissect. Yes, cutting apart or separate tissue of surgical purposes for visual or microscopic study. So you'll see dissect again. Diverticulum. We've seen that as well in digestive, right? A pouch or sac in a wall or an organ or canal. So we see this again, diverticulum. All right, electrocautery. You see that? That's a procedure. All right, let's go through and let me see. Fascia. Fascia. So if you notice that, you'll see that in when you're doing integumentary, sometimes with debridement in the first section of your book, you'll see when they're doing different type of getting my words tied up, sorry. You'll see the upper, the epidermis, the dermis, the muscular, the bone, down to the bone, the fascia down to the bone. So you'll see the term fascia, okay? Fistula, abdominal, abnormal tube-like passage between two body cavities or organs from an organ. All right, let's pull this book up again and let's look at some other terms. Fixate, flap. You see that also that term in integumentary, flap. All right, fluoroscopy. Now, students, this term is very, very popular in digestive. Really, you see it in digestive. Fluoroscopy is like a moving x-ray. It's like a videotape. It's like a moving x-ray. So you'll see a lot of, including fluoroscopy. You'll see that in radiology, but you'll see it in other sections. So fluoroscopy is using Foley catheter. Okay, it's an indoor. That is if you say it's a Foley catheter, it's a foreign body. You didn't born with it. So they are using this inside of the catheter, okay, to create a balloon. Look up Foley catheter, okay. Look at diagrams. All right, this video is a little long, so I just need you to stay with me. Let us go through. Now you see foreign body. Remember when I told you an object or substance found in an organ or tissue not belonging under normal circumstances. I don't remember which video I had mentioned that my instructor told me a foreign body is nothing you're born with. So if you have a tumor, if you have liquid, you have anything that they put in a screw, whatever that they put in your body that you did not born with, it's a foreign body. So you notice that I made a mistake here. That is not A and P. So I left it there because I wanted to show you that when you go back through your notes, this is FB, foreign body. This is not A and P. A and P is anatomical. So foreign body is not anatomical. And that was a mistake of mine when I was a student. So pay attention. So A and P, this is incorrect. So when you go through your notes, you have to make sure when you go through your notes, the information is correct, right? But I leave my imperfections there so you can see that as an instructor, as a tutor, you'll see that I make mistakes too. And I was a student, but I love using this book. All right, fluorigation, destruction of living tissue, usually sparks from high-frequency electric current. All right, fulgation, destruction of living tissue during sparks from I did that one already. Homograph. So you have allograft, you have autograph, and now you have a homograph that they're taking one part from one part of the body and then they using it back into another part, right, from an individual. All right, some of these things I don't see much on the test, so you can go back through, maybe watch this video again, And you can see that incontinence, that is a diagnosis. So I have been going through some of these things, but a lot of it, look at the hypertrophic enlargement or overgrown from an increase in cell size of an infected tissue. That's a diagnosis, right? Impotence, that's a diagnosis. Diagnosis, right? It's for male who is unable to hold an erection. Impotence. So in the male section, they might use the prosthesis for to help a man with an they call it inflatable prosthesis. So some of these things you might see, you're going to see it on the test with the inflatable prosthesis. That might be a question. So look out for that. Laceration, injury or tear. You see that a lot, mainly right here. Laceration right here. You're going to see that mainly in integumentary. Okay. Laser surgery, you're going to see that too. But the most popular one in this section is lithotripsy, right? So a lot of it is basically destroying of gallbladder stones. That's the easiest thing I can basically come close to it. And most time it's just one code for lithotripsy. So the minute you see lithotripsy, you go to the ESWL code and you're good to go. So this is pretty much, once you see lithotripsy, that's an easy question because only one set of codes for that one. Okay, lithotripsy. All right. Lumen, space between the artery and the vein. Marsupication, we've seen this before. We're seeing this again. We might see this in female as well. So you're going to see this as well when they're taking away cysts in the vaginal area or the vulva area. Okay. Meatus, opening or passage in the body. All right, let's see. Nephrostomy. So you have to know the difference with renal and nephro. Okay. So this has to do with the kidney, and they're doing a surgical opening. Okay. In the renal pelvis. All right. So let's move up here. Let me move this thing up here. Now, so you see you have the orchoectomy. All right. And then look at this. The removal of the testicles. Ooh, that hurts. Ectomy right there. All right. Perineal, you look like peri. Peri means around, right? So peri means around an area. Okay. So when you see PERI, that is a prefix. All right. And then al. So you have peri and then al. So al means pertaining to, right? And peri means around. So some of those things, is a structure, okay? So if you see a structure around what, right? Those are some of the stuff that you can look at and then you know right away. Prolapse, falling. A lot of the times you might see that. We've seen prostate, which is that is an anatomical part. Retroperitoneal. This retro, you remember we seen retrograde. Now we see retroperitoneal. Okay, so now you look at this one. Let's take a little look at this one. Peritoneal, which is al, pertaining to, behind, around. So in this area is in the abdominal area. So if you notice that you have different system in the abdominal area, so that's what they're talking about. Scrotum, seminal vesicles, these are anatomical sites. All right, let's turn the page. We're almost done. We're almost done. This one is a little long because we're doing 2 in 1, okay? All right, so let's look at this one. All right, a stent. Now, this is very, very popular. You have stent everywhere once there's a tube, right? Cardiovascular, there's stents. Digestive, there's stents. on test there is any for respiratory? No, I don't see any stent questions for respiratory. But you're going to see stents in cardiovascular. You're going to see stents in digestive. And now you see stents in urinary. Right? So pay attention to these things. This is a little thing that supports. They want to put the stent in help with the opening, so liquid, blood, whatever can pass through. Okay, stress urinary incontinence. Look at stoma, right? So that's a procedure too. They create a stoma. This is a suffix right here. That's a suffix. So you have stoma, stomy, which is similar, right? So you know your surgical suffix, ladies and gentlemen. Stricter, narrowing. So that's a diagnosis. So you might, let's say liver, you have a hepatic stricture, right? Narrowing of an anatomical structure. You'll see subcutaneous tissue. A lot of the times when they're doing like muscular, integumentary, you might see subcutaneous tissue. That's on the, look at the diagram of, let's say, the integumentary, you will see that, all right? You have testes, that's an anatomical site. Prosthetic implant, you're going to see this, TERP. Sometimes you might see it on the test with anything prostate, that you're going to see that on the test. Okay. That's very common. I shouldn't say you're going to see it on the test, but it's a very common topic, okay? Urethra. So now you might see urethra, R-A, right here. Look at this. And then you have ureter, ends with an E-R. So pay attention which one. So you have the ureter, E-R, that is connects the blood, the kidney, is that tube, to the urinary bladder. That's the ureter. So you have the kidney, then you have the ureter, then you have the bladder, then you have the urethra. So you have kidney, ureter, then you have the bladder, then you have the urethra. So look up that diagram, okay? Urethrostomy. There we go again. So urostomy. So it's an opening, right, to create blood flow. Okay? So that urine, okay? Vascularization. We've seen that in cardiovascular where they did revascularization. All right, surgical induced development, right here. Vas deferens, a duct that arises in the tail of the epididymis, that's A&P. That's a body part in the male reproductive system. And then guess what? We are done. So the next video I'm going to do is female. So I want you to look out for it. Please subscribe and please keep replaying it so you can learn it. Get your study guide, all right? And guess what? Talk to you next time.